Hello and good day to all of you, healthcare assistants. Today we will be covering infection prevention and control, and I'll be your facilitator today. My name is Margaret Baikile Santos, and I work as a national microbiologist at the EPSM Department of Health and Social Affairs under the ELC program. So the learning outcomes for today are discuss the principles of IPC. For patient and personal safety, we have to describe the methods to prevent transmission of bloodborne pathogens and other infectious pathogens, and also to apply the principles you have learned of standard and transmission-based precautions in infection prevention. So the outline of today's lecture will be, we have to know the definitions of IPC, hierarchy of IPC, and the measures that we can use, the chain of infection, how diseases are spread, and the standard precautions. These are the IPC precautions that we need to practice, and transmission-based precaution as well as bloodborne pathogens. So first of all, what is infection prevention and control? So IPC is a practical and evidence-based approach to prevent patients and health workers from being harmed by avoidable infections. So avoidable infections mean these are infections that we can prevent from getting sick. So let us have a look on the hierarchy of infection prevention and control. So there are actually three components to how we implement APC. So the first one is administrative measures. That's mostly the IPC guidelines and standard operating procedures and policies we have in place to guide all the health workers to follow practices of IPC. The second one is engineering measures. These are the structural and facility structures we put in place to isolate patients who are sick with infectious disease from other people. So if you know, during COVID, we have quarantine being put into place because that's where we put people to get cleared before they're able to come into the community. So that's another example, and we've all been exposed to it during the COVID pandemic. Another component is the personal protective equipment, that's abbreviated as PPE. However, it is considered the least effective measures, and therefore we should be using this in combination with other mitigated measures. So let us have a look on the chain of infection. Now, with the chain of infection, if there is a link or there is a break in any of the link, it means infection cannot be transmitted. So on this presentation, it's actually a chain, and it has several components where you are able to break, and then you can prevent the spread of infection. So let's have a look on the chains. So first of all, you need to have a pathogen. So it can either be a bacteria, virus, fungi, or parasite. And it lives on a person or animals, soil, food, or water, known as the reservoir. And then it has to have a way of exiting the reservoir to pass on to the next person. So, for example, if someone has flu, so the portal of exit would be through coughing and sneezing. So that's either through the mouth or the nose. And then it will spread to another person, either through direct contact or indirect contact. So in that case, if that person doesn't wipe the hands properly with disinfectant after coughing and touches any other surfaces or touches another person, and it's transmitted through to the other person. And then it has to go through a portal of entry. It means how does it enter into the next person? So it can go through the mouth, nose, eyes, or even cuts on the skin. So in the case of flu, the person might again touches the face, the eyes, or even put something into the mouth, and then the virus will spread to the next person through the portal of entry. And usually a person gets sick, very sick, if they are so immunocompromised. So the susceptible host will then get sick. So we have in our community different range categories of people. Some are immunocompromised. It means they have other terminal illness, then they can get sick if they're exposed to any infection. And the elderly, because of the immune system is kind of weakened as they age. And for the infants, because the immune system is still developing. So let's have a look on transmissions. How does a disease or infection spread? So it can be through contact transmission. So that's either through direct, so vertical transmission, or horizontal transmission. So direct vertical could be when a mother has HIV or hepatitis B, and then the baby will acquire that particular virus. Or direct horizontal transmission, that's, for example, through sexual intercourse. And an example would be the STIs, like gonorrhea, syphilis, and also HIV. And indirect contact transmission, it happens through fomites that become contaminated by pathogens from one infected person. So examples of fomites can be a table surface, the high touch areas that everybody is exposed to. Vector transmission is another mode of transmission of diseases. So that's through a biological or mechanical vector. And an example of a biological vector is transmission of dengue by mosquitoes. So mosquitoes are the biological vectors. And the third one is vehicle transmission. So these are other types of substances around us that can transmit the pathogens. So, for example, water is an example of vehicle transmission, food, and air. So, I'll give you three examples of types of diseases that can be passed through that. So, typhoid can be passed through water as well as food. That's why we have to have clean water, and also hand washing is important. Foodborne, for example, those foodborne diseases that can be spread if the food is not kept clean or not, we don't use clean water, and then you'll transmit it, some of the pathogens like salmonella or E. coli. And giardiasis, which is a parasite. And airborne, mostly the pulmonary TB and influenza virus. So now let us look on the standard precautions. So there are actually 7 of them, or around about 7, but we'll cover all of them. So these precautions actually reduce the risk of exposure for the healthcare worker and protect patients from potential transmissions of infectious microorganisms. So here's the list. If you can see the handout, we'll start first with hand hygiene and cleaning of patient care environment, respiratory hygiene and cough etiquette, disinfection and sterilization of patient care equipment, how to manage the clinical and biomedical waste, and how to manage the hospital linen. These are bed sheets and other linen we use in the hospital care setting, as well as personal protective equipment and needle and stick injury management. So let's have a look on the first precaution that we need to always practice, which is hand hygiene. So you'll see on the handout, I put 2 pictures or diagrams, and it kind of show us some illustrative information. So our hands are actually really dirty. I mean, it's the most contaminated part of the body because whenever we pick items and we do our daily chores or in at work, our hands move between different places. So our hands kind of harbor a lot of germs. So sometimes we term it as the germ farm. So hand hygiene is an important part. So when you continually do hand hygiene, you'll be able to kill, remove, or even destroy those living microorganisms and any other visible contaminants on the hands. Now, the 5 moments of hand hygiene is very important. So make sure you do a hand hygiene before you touch any patient that you're dealing with. And don't forget to do a hand hygiene before you do any aseptic procedure. And after you touch a body fluid, which is kind of high risk of any samples from a patient, make sure you wash your hands also. And when you touch the patient, and as well as after you're touching the patient's surrounding. Now, for the hand hygiene, there are actually two ways you can do hand washing properly. If your hands are not really visibly soiled, you can use the alcohol rub, which is a 70% alcohol base, for 20 to 30 seconds. Now, if your hands are really visibly soiled or contaminated, you have to use soap and water, and that will take you 40 to 60 seconds, which is roughly to 1 minute. The next precaution is respiratory hygiene and cough etiquette. So it should be practiced by all people who have signs of coughing, congestion, or production of a lot of secretion. So if someone is coughing, we encourage them to cover their nose and mouth with tissue or handkerchief, and they can even um, cough over the arm, at least the elbow, to stop spread of virus, as you can see in this picture. And after using those, you have to throw those tissue in a proper bin, waste bin, and also to do hand wash straight after that. So that's one of the precautionary measures. And the third one is needles and sharps management. So in the healthcare setting, you can be required to also administer immunization or even injection of some medication. So therefore, you need to ensure the needles that you use are properly disposed of after you use them. Now, bloodborne pathogens are actually organisms that can be spread through needle stick injury. So we kind of advise the healthcare workers to never recap, never bend or break any needles once they're done with using the needles and syringe. They should dispose of it in a proper sharps container. So here's a picture to show how a sharps container, a recommended one, is shown. And always have the sharps container at your place of work. So in any healthcare setting, you need to have those at place and use it for all your sharps and needles. Don't throw your sharps and needles in a biohazard waste bin. And never fill the sharps container more than 3/4 full. And when it's full, you need to close and put it through incineration for final disposal. Should there be any needle stick injuries during your time of work and the place of work, make sure you establish a reporting incident. So there should be a form that you will complete to ensure that you have records. And if also in a policy, there should be a process to do baseline testing, and then you do a testing after 3 months and 6 months to clear you from those bloodborne pathogens like hepatitis B, hepatitis C, as well as HIV. So the next standard precaution is the personal protective equipment. We usually refer to it as PPE. So it is a specialized piece of clothing or equipment that we use to prevent the spread of infection. So it builds a barrier between us and any infectious agents, and it will actually help prevent spread of infections between staff, patients, and visitors. So examples of PPE are shown there. We have gloves, gowns, coats, aprons, facial protections like masks, and eye goggles, as well as eye shields. And in certain situations, they will use respirators. But the basic ones are the ones I've explained earlier. And during the COVID pandemic, every healthcare worker were being trained to know how to use the personal protective equipment. So at a place of work, it is also good to have the donning and doffing. It means how do you put on the PPE as well as how do you take off the PPE.
Today, I will be demonstrating on how to put on and remove my personal protective equipment, the PPEs. So, before I start, I need to gather all my items, make sure they're my size, make sure the integrity is okay. And then now I will start. First, I will need to do hand washing. I will wash my hand, wash my hand, and then I will start with the gown. The first item that we will put is the gown. This is how you put your gown. Make sure you tie it very well. If you have a partner, it will be much easier. Yeah. But if once you're alone, you have to be on your own. And then I will use the mask. Make sure your mask is like this, one down to your chin. And then we press this part to be really secure. Then the face shield. And prepare using the face shield because it covers all your face. Now the glove. The glove, you have to make sure that it's really your size. Because if it's too big, it might slip off your hand. And if it's too small, it might get torn. And then make sure that you cover the sleeve of your gown with the glove. It better be right one cover glasses. Okay, so this is how you put on your PPEs, and this is the sequence. Now I will demonstrate removing my PPEs. First, I will wash my hands. The first thing I remove is my glove. Here you don't touch the front of your gown because it is the most contaminated place after taking care of a patient. Okay, just touch the inside. You can do like this. I'm just touching the inside. And then inside out like this. And you clean and wash. You and wash after removing each item. Okay, now I will remove my face shield. You touch the back. You don't touch the front. And wash again. Okay, and my mask. The mask is the last item causing conversing from the beginning to the end. You touch this part. Don't touch the front. This. Wait, okay. That's all. Thank you.
So let's move on to the fifth standard precaution, which is mostly related to how you care for the patient care devices. So disinfection and sterilization of patient care devices. So disinfection is term or the word we use when there's total removal of microorganisms, but it doesn't destroy all spores and viruses. Sterilization is an ideal way that we can use, and it destroys all pathogens on any equipment or the environment, and it also can kill spores and viruses. The methods included steam, boiling water, dry heat, radiation, and chemicals. Now, steam is mostly through the method of autoclaving, and it's mostly done in healthcare centers. Now, cleaning, on the other hand, is just a physical removal of foreign material, including dust, soil, and any organic material, such as blood, secretions, excretions, and microorganisms that can be present on any item um, or any patient care devices at the health center. And also note your skin can only be disinfected but not sterilized. So we have two pictures over here of examples of disinfectants. We have the Clorox, commonly used Clorox, as well as the alcohol hand liquid wrap. So let's have a look through those types of disinfectants and how they action on all the different types of microorganisms. So the disinfectants are classified as high level, intermediate level, and low level. So the high level ones can actually destroy all organisms, including fungi, viruses, and most bacterial spores, including TB, but not some other bacterial spores. So example will be the 1% sodium hypochlorite. These are found in the bleach solution. Intermediate level disinfectants can destroy TB and most viruses, especially enterovirus, that some of them can cause polio, and fungi, but not bacterial spores. So example would be the commonly used 70% isopropyl alcohol, which is the base in alcohol hand sanitizers, and also in 0.1% sodium hypochlorite is a solution that can be made out of the bleach. So low-level disinfectants are not really strong, so they will destroy most of the live bacteria and fungi and some envelope viruses, but not bacterial spores or TB. So we use soap, which is good. An example of the low-level disinfectant is actually the soap and pine salt. Now, if you're going to prepare bleach, it can only be active for 24 hours. So just prepare enough to use for the day. So here is a slide to show you how you can prepare your solution from the concentrated bleach as a disinfectant. So if you would like to prepare 0.5% from a bleach that is 3.5% concentrated, then you take 1 part of the concentrated bleach, you add it to 6 parts of clean water. So it means you take 1 cup to 6 cups of clean water. And if you want to dilute it to 1% from a concentrated bleach of 5%, that means you take 1 part to 49 parts of clean water. So you take 1 cup of bleach and 49 cups of water. So these are the simple formulas and measurements you can do to prepare your bleach for your daily use at the healthcare sector. Now, sterilization, as we have discussed the different types of way to maintain patient care devices, we have different types of sterilization methods: physical, chemical, and low temperature sterilization. Now, physical is mostly the autoclave methods we use at hospitals, and even at your health care center, you will have the small autoclave machines. And you can set it for 121 degrees Celsius. That will take you up to 20 minutes for the whole run. Certain chemicals can also be used. Example is ethylene oxide. And for low temperature sterilization, they can use acetic acid or hydrogen peroxide using a plasma sterilizer. Now, monitoring of sterilization is also important so that you know the process is effective and you have actually killed all of those microorganisms. So you can monitor that with the time, temperature, and pressure, as well as those indicator strips that we have commonly used at the CSSR or CSSD. The next one is cleaning of patient care environment. We have to ensure where the patients are has to be clean in a healthcare setting. So there should be some instructions on how and when to clean. There should be disinfectants available and stocked at all times, and always clean from a cleaner to a dirtier area to avoid spreading dirt and microorganisms. So that means you clean the low touch areas before high touch areas, and you clean patients' areas before patients' restroom. And then you clean from high to low. It means from the top to the bottom. So bed rails before bed legs, for example, tabletops before floors. And if you have spills at your health centers, make sure you clean them up immediately with disinfectant that you have. So bleach is always a good disinfectant, and make sure you have your 0.1% or 0.5% always ready for your day's work. So some of the examples of medical equipment that we use for patients are usually like IV pumps and blood pressure machines, even the stethoscope, because we've been using it between patients. Environmental surfaces that are around at your health facility could be the bed rails, tabletops, and floors. And then the high touch areas are usually parts of the building that a lot of people touched. So the door handles, the light switches, bed rails, end of the beds, patient charts, monitor buttons, IV pumps, as well as the faucet handles in the restroom. So these are the sites where a lot of people touch, and they can be highly contaminated with microorganisms. The sixth standard precaution is biomedical waste management. So we know there's a lot of waste generated at a place of work, and it's all different kinds of waste. These are the examples of medical waste, like swabs or dressings that are from patients, the needles and syringes that you have actually used, and also blood or other body fluid excretions, not forgetting human tissues, as well as drugs and pharmaceutical products. So, what are the best practices that you need to do in managing waste? So, you need to sort out your waste by type. So, it means if you have medical waste, you have a separate bin for those waste, and your common waste like papers and plastics needs to be in a different bin. And you can color code the medical waste bins and even the waste bags so you know which one means which. For example, you can use yellow or red for medical, while white or black for common waste. And then make sure you use a leak proof bin so that it doesn't leak off if there are some body fluids in the medical waste. It is important that you need to segregate the waste at the source. And when we dispose biomedical waste, it has to be done in a way that we prevent any danger or harm to yourself, the patients, and other members of the staff, as well as the community. Health facility linen management is also one important standard precaution. So in the hospital, we have beds and we need to cover those beds with linen. And we come into contact with patients who can be sick that use the linen. And then they pass on the microorganisms to those linen. So we need to wash them separately from other items. And at times, the linen can be soiled, maybe with blood or tissue. Maybe we have a patient that come in with a cut. Therefore, we need to bag those soiled linen. It means we put them in a bag separate from all the other non-soiled linen for wash. And you need to wear your PPE at all times when you are handling those infected linen or contaminated linen so that you don't acquire any germs. If you are using work uniform, make sure you change it daily and you wash them through hot wash, as well as making sure the linen needs to go through a hot wash cycle if you're using the washing machine, for example, because the heat and bleach can actually those microorganisms. So those are the 7 standard precautionary measures that I've covered. Now let us move on to transmission-based precaution. So this is actually the second tier of basic infection control and can be used with the standard precaution. And it's used for patients who may be infected or colonized with certain infectious agents, for example, those microorganisms that are so resistant to all the common antibiotics. We sometimes call them multi-drug resistant organisms. So it comprises of contact precaution as well as droplet precaution and airborne precautions. So you need to add all of these 3 with the standard precaution. So if we have a patient being put into isolation room, that means you need to have this additional transmission-based precautions practice. So contact precautions, so everyone must clean their hands before you enter the room and before you leave the room. Remember, the patient is in this isolation room. Make sure you have your gloves on too, as well as your PPE. And before you enter, you put on the gloves, and before you exit, you take out the gloves. So you have a separate bin inside the room to dispose of those items. Now let us move to transmission-based precaution. So transmission-based precaution are the second tier of basic infection control and are to be used in addition to the standard precaution for patients. And it is mostly used when patients are colonized or infected with multi-drug resistant organisms and they are being put into isolation wards. So there are actually 3 transmission-based precautions that can be used in addition to the standard precaution. First is contact precaution, the second is droplet precaution, and airborne precaution. So for contact precaution, everybody must clean their hands with sanitizer and then they have to clean their hands when they leave the room. And as a staff, you need to also put on the gloves and your other PPE before you enter the room. And when you exit, those PPEs that you use in the isolation room needs to be disposed properly in a bin that is provided in the isolation room. If you use any patient care equipment on the patient, we need to also make sure it is disinfected before you exit the room with it. The next transmission-based precaution is droplet precaution. So hand hygiene is important, so you need to make sure you do that. And you have your masks on as well. And if you need to wear your safety shields on, you can put that on. So ensure it's being put on before you enter, and then you make sure you take it out upon your exit too, because we don't want to take that PPE out from the room. And should you use or need to put on an N95 in place of a mask, that's when the airborne precaution is crucial. So you will wear that instead of a mask. These are the additional measures you need to put into place. So this one is just to explain in further, like transmission-based precaution contact, the PPEs that you require, and special consideration on what you need to do. So this is our final slide, which is on bloodborne pathogens. So as I earlier touched on, most commonly known bloodborne pathogens are HIV, hepatitis B, and hepatitis C. But there are also other microorganisms that can be spread through blood. So make sure in your place of work you have an SOP. So what will happen if anything happens? What are the procedures you need to follow? And if you need to take a vaccination shot for any of those, if you haven't had, it is best that you follow that. Make sure you know how you dispose of those items that come into contact with the blood and use the proper PPE. Not forgetting hand hygiene is always important, as well as sharps management and where you dispose of those medical waste. So thank you. I hope you've enjoyed this teaching module on IPC. Thank you very much.